Welcome to the Bioscan Hub channel. If you're passionate about lab science, go ahead and hit that subscribe button to support us. We'd really appreciate it. Today, we are diving deep into one of the most powerful diagnostic tools we have, the simple urinalysis. It might seem basic, but trust me, a urine sample is like a liquid diary of the kidneys, and we're about to learn how to read it.
It's a fantastic question, isn't it? How can this one test tell us so much? Well, for the next few minutes, I want you to think of yourself as a medical detective. The urinalysis report, that's our collection of clues. We're talking proteins, cells, and these amazing things called casts. Each and every finding is a clue that points us toward a specific problem, helping us solve the mystery of what's really going on inside a patient's kidneys.
All right, let's get into it. Our investigation begins right at the start of the nephron, which is, the kidney's tiny functional unit. We're zooming in on the glomerulus. This is the absolute powerhouse, the main filtration system of the kidney. This is where the entire process of cleaning your blood kicks off.
The easiest way to think about the glomerulus is like a super advanced coffee filter. Its job is to let all the bad stuff, the waste products and extra water pass through to become urine, while making sure all the good stuff like big proteins and our red blood cells stays behind in the blood. So what happens when this filter gets damaged? Well, it starts to leak, and the things it leaks become our first major clues. Okay, case number 1, acute glomerulonephritis. The name says it all. Itis means inflammation. So this is an inflammation of that glomerular filter, and it's often triggered by something like a recent strep throat infection. Now look at the key findings here. The inflammation makes that filter leaky, so on the chemical strip, you'll see blood for sure. But notice the protein, it's pretty low, less than 1 gram. That tells you the main story here isn't about protein loss, it's about bleeding.
Now this is where it gets really important. The number one, absolute, definitive clue is the red blood cell cast. So what's a cast? It's literally a mold, a hardened mold of the kidney's tiny tubules. If you find a cast that is packed solid with red blood cells, that is undeniable proof that the bleeding is happening inside the kidney, specifically way up high at the glomerulus. See, bleeding from the bladder can't form a cast, so finding an RBC cast, that's the smoking gun for glomerular damage.
All right, let's look at our next glomerular case, which is nephrotic syndrome. Now, this is a totally different kind of filter problem. It's not just inflammation. Here, the glomerular membrane itself has become extremely permeable. The holes in our filter have gotten huge, and that leads to a massive, and I mean massive, leakage of protein. We're talking more than 3.5 grams per deciliter. And this huge protein loss kicks off a side effect. The body starts leaking lipids or fats into the urine, too.
So the key takeaway for nephrotic syndrome is this fatty profile. It's a chain reaction, really. When the body loses all that protein, the liver goes into overdrive to try and make more. But in doing so, it also churns out a ton of extra lipids. These lipids spill into the urine and get soaked up by the kidney's tubular cells, creating what we see under the microscope as oval fat bodies. And when those cells get packed into a cast, you get a fatty cast. Finding these is the absolute telltale sign of nephrotic syndrome.
Okay, we've investigated the main filter, but what happens if the damage occurs further down the assembly line? We're now moving into the kidney's plumbing, the tubules, and the crucial support tissue that surrounds them, which is called the interstitium. So here we have acute tubular necrosis, or ATN. And the key word to focus on here is necrosis. Necrosis means cell death. This is the literal destruction of the cells that line the kidney's tubules. It's usually caused by something sudden and severe, like a state of shock that cuts off the kidney's oxygen supply, or maybe direct poisoning from certain drugs or heavy metals. The cells literally die and peel off into the urine. And this slide shows you the direct evidence of that destruction. Finding individual renal tubular epithelial cells, or RTEs, in the urine is like finding bricks that have fallen off a crumbling wall. It's a bad sign. But the most definitive, undeniable proof of ATN is the RTE cast. This is a cast made up of those dead and dying cells. It sends a crystal clear message that there is widespread, severe damage happening directly to the kidney's plumbing. Now let's contrast that with acute interstitial nephritis, or AIN. This is different. This is not cell death from a lack of oxygen. Instead, AIN is an inflammatory or allergic reaction that's happening in the interstitium. That's the supportive tissue between the tubules. And more often than not, this is caused by a hypersensitivity reaction to a medication. So if the cause is an allergic reaction, what's the clue we're going to look for? Eosinophils. These are a very specific type of white blood cell that our body rolls out as its special forces for allergic responses. Finding these guys in the urine, especially if the patient also has a fever and a skin rash, is a highly specific marker that points the finger directly at acute interstitial nephritis.
Okay, let's switch gears and talk about one of the most common things you'll ever see in urinalysis: urinary tract infections, or UTIs. Our job as detectives here isn't just to say, yep, there's an infection. It's to figure out exactly where the infection is. Because when it comes to UTIs, location is everything.
So a UTI usually starts low, down in the bladder. We call this cystitis, or a lower UTI, and while it's definitely unpleasant, it's generally not too difficult to treat. The real problem starts when those bacteria decide to travel up the ureters and invade the actual kidney tissue. That is acute pyelonephritis, an upper UTI, and it is a much more serious situation. So how do we tell the two apart? This slide is absolutely critical. In both cases, you're going to see the classic signs of infection, lots of white blood cells and bacteria. But the game changer, the one single finding that separates a simple bladder infection from a dangerous kidney infection, is the presence of white blood cell casts. And why is that? Because, as we've learned, casts can only be formed inside the kidney tubules.
This right here is the rule you have to remember. If you see white blood cells, the cells that are fighting the infection, being packed into a solid cast, it means the battle is taking place inside the kidney itself. The presence of WBC casts immediately elevates the diagnosis from a simple cystitis to pyelonephritis, and that signals a far more serious infection requiring much more aggressive treatment.
Whew. Okay, so we have covered a ton of ground, right? We've gone from the glomerulus to the tubules, all the way to the urinary tract. So let's pull all of our detective clues together into one simple, powerful cheat sheet that you can use every time you look at a urinalysis report.
Here it is, your diagnostic cheat sheet. Each type of cast tells a unique story and points to a very specific location of injury. So, you see an RBC cast? Boom, you know there's bleeding in the glomerulus. You see a fatty cast? You're immediately thinking nephrotic syndrome. An RTE cast tells you that tubular cells are dying in ATN. And a WBC cast? That confirms a kidney infection or pyelonephritis. It's that simple.
At the end of the day, this is the single most important lesson. While looking for protein and blood and individual cells is important, the casts are the true storytellers of the nephron. Because they are physically formed within the kidney's architecture, their contents give us a direct, unambiguous report about what is happening deep inside. They are our most reliable witnesses.
So I'll leave you with this thought. The next time a urinalysis report comes across your desk, don't just look at the numbers and the words. Read the story. Ask yourself, what are these casts trying to tell me about what's happening inside that nephron? Because finding that answer, well, that's what it's all about. Thanks so much for watching.